Okay, everybody, let's go ahead and get started. So first of all, welcome. Thank you for joining us today for today's webinar. My name is John Munoz, and I'm the Deputy Administrator for Juvenile Services at the State of Nevada Division of Child and Family Services. Today we are presenting Nevada's Juvenile Justice System Reforms, AB472, and the YLS CMI Review and Implementation. This brief presentation is about AB472 and the Youth Level of Service and Case Management Inventory Risk Needs Assessment. The presentation will include an overview of the juvenile justice reforms and how they will affect your role as a court partner. We will be reviewing the impact of AB472, the goals of the JJOC strategic plan, the Youth Level of Service and Case Management Tool, Risk Need Responsivity, ensuring effective implementation, and newly required court findings. One of our presenters today is the Honorable Egan Walker with the 2nd Judicial District Court. Judge Walker is also the co-chair of the Juvenile Justice Oversight Commission. I also have the pleasure of introducing 2 guest speakers from the National Youth Screening and Assessment Partners. Their work is centered on improving the juvenile justice system's capacities to identify the needs of the youth, thereby promoting the health and development of adolescents in contact with juvenile justice. They facilitate juvenile justice systems implementation of reliable, evidence-based methods for screening and assessment of use with a focus on behavioral health, risk assessment, and case management practices that are grounded in risk need responsivity principles. NISAP has over 20 years of experience assisting the juvenile justice agencies and adolescent programs to select appropriate screening and assessment methods, develop appropriate policies for their use, train personnel in those methods and policies, as well as how to arrive at appropriate decisions about youth and assist in the development of sustained quality of practice, including quality assurance. Dr. Gina Vincent is an associate professor and co-director of the Law and Psychiatry program, at the University of Massachusetts Medical School, also president of NISAP. Along with Dr. Vincent is Mr. Kelly Clement. He is an adjunct professor in Criminal Justice Department at Nichols State University and Fletcher Community College. He is also a NISAP associate. He served as the regional manager for the Louisiana Office of Juvenile Justice, leading up to his retirement in 2015 after 28 years of service. And last but not least, we have our guest speaker, Ms. Pauline Sala, the Director of Juvenile Services with the Judicial District. Before we get started, we have a few little housekeeping items. If you have any questions during the presentation, please type them into the GoToWebinar chat panel there in your GoToMeeting taskbar. I will bring them up during the presentation. We will also have time for questions at the end. If you have to step away for a minute, please do not put your phone on hold. Simply mute your phone or the microphone on your computer. We also ask that if you're not talking or speaking, that you put your phone on mute so that we're not competing for the microphone. Now, without further ado, we will turn the time over to Judge Walker.
Good morning, folks. Thank you very much for your time this morning. I want to talk about where we've been and where we're going related to juvenile justice issues in the Juvenile Justice Oversight Commission. If you move to the second slide, please, you'll see a little bit of a discussion of the history of AB472. The history really involves Justice Seda and the former First Lady applying for and receiving technical assistance through the Justice Center of the Council of State Governments, what we call CSG. Receipt of that award, triggered a year-long process to analyze Nevada's juvenile justice system and develop recommendations for change. The process included a convening team of Nevadans from all branches of government and all corners of the state, together with national experts, and the final recommendations were included in one of Governor Sandoval's signature bills for the 2017 legislative session. To quote Governor Sandoval, this legislation really represents a unified effort by all 3 branches of government to better protect public safety and improve outcomes for youth in our juvenile justice system. It established the Juvenile Justice Oversight Commission and an advisory committee to the commission. There are 25 commission members and advisory committee members together in partnership with DCFS and county probation and state youth parole. The Oversight Commission helps oversee and execute reforms. Next slide, please. What we learned, or the questions we learned we need to ask as a result of that statewide kind of top to bottom overview are really in 3 major areas. First, we needed to understand how well our policies and practices currently align with what research says works to reduce recidivism and improve youth outcomes. We need to ask to what extent are leaders from the three branches of government working collaboratively in partnership with local governments to improve outcomes for kids, and what is our recidivism data? We learned that really what we need to do is establish a system that reacts to the needs of children, not because of how much they scare us or how much they make us angry, but instead what is going to drive good outcomes for children. Next slide, please. The qualitative analysis really is based on four core principles demonstrated by research to improve outcomes for youth. The first principle is that supervision, service, resource allocation, and decisions, including judicial decisions, should be based on validated risk and needs assessments. The second principle is that we had to adopt and effectively implement programs and services that are demonstrated by science and evidence-based practices to reduce recidivism and improve youth outcomes, and then critically evaluate those results to guide system improvements and sort of a continuous quality improvement loop. The third principle is that we need to employ a coordinated approach. We have a bifurcated system of probation and parole in Nevada, and we need to coordinate the approach across those and other systems to address youth's needs. And then the fourth principle was that we have to tailor system policies and programs to the distinct needs of individual adolescents. Next slide, please. When we looked at Nevada's juvenile justice system, we saw several things. First, there's a system-wide commitment to divert youth. And so 70%, at least as of 2015, 70% of the children who were referred to any particular juvenile services agency for services were diverted, and or their cases were closed outright. 4% of those kids had informal responses by the system. 20% of those, or 26% of those kids were adjudicated, and the mix of where those adjudications landed those kids is demonstrated in the graph. So that's a good observation. There's a strong focus in Nevada already on diverting youth, really in large part, I think, to the anti-KC JDAI initiative. There's county implementation of those reform initiatives, commitment to keeping youth in the community, and increasing knowledge across the state about a need to focus on evidence-based practices and data-driven decision-making. And we have a history of reform commissions. Several of us have had the privilege of being on multiple Supreme Court commissions and or the State Advisory Commission. That's really good news. Next slide, please. What we saw, though, as a challenge is that youth in Nevada who aren't diverted from the system often recycle through the juvenile justice system. So, for example, youth who are diverted on average had 1 prior referral. Youth who were probated had 6 prior referrals. Youth who were sent to a county placement camp had 8 prior referrals. And committed youth, on average, had 11 prior referrals. So clearly we were missing some opportunity to provide the right services to the right needs at the right time to prevent that recycling. Next slide, please. So the key takeaways, again, are that data and analysis on system performance and youth outcomes is limited in Nevada and not regularly used to guide system improvements. Many youth on probation and parole have subsequent contact with the juvenile justice system, often resulting in further time on supervision and or deeper penetration into the system. And technical violations are a disproportionate driver of why youth on community supervision are placed in state custody. Now, I want to add here and in the subsequent slides the comment that there are kind of unique prosecutorial decision-making points or policies in Nevada about how the local DA's offices choose to handle probation violations or parole violations as opposed to the addition of new charges. And I don't want to overstate that the technical violations, i.e. probation violation or parole violation, are inappropriately disproportionate, but we need to tease out why we're recycling these kids a lot. Next slide, please. So we learned that there are tools that are used across the nation that are validated for broad cross sections of populations of children that are demonstrated to help tease out the services that a child needs at any particular time, and how those services can best be implemented in a child's life. And the two particular tools that we hit upon in the Juvenile Justice Oversight Commission were the Youth Level of Service Case Management Inventory, or the YLS CMI tool, and then the Massachusetts Youth Screening Instrument, or the MAISY-2, the second version of that. Next slide, please. And so the question becomes, why is this approach? Why is the use of tools and risk need responsivity planning so important with youth? And I'll turn the commentary over now to Dr. Vincent and Mr. Clement.
All right, thank you, Judge Walker. Hello, everybody. So I am Gina Vincent from NISAP, and it's been my pleasure, and Kelly, my associate's pleasure, to work with the state around implementation of the YLS and eventually the MAISY as well, as Judge Walker mentioned. And I think you all have a unique and wonderful opportunity to do some amazing work with adolescents who are coming into your system. You've already been doing a lot of great work with adolescents coming into your system, as Judge Walker mentioned. But you've got this piece of legislation that is one of the best that we have seen, and we've done a lot of work with a lot of different states. AB472, I think, is positioning everybody very well to take that next step in making some positive juvenile justice reform in ways that are informed by the evidence and what we know about adolescent offending. And so my role in this workshop is really to talk a bit about the evidence behind the recommendation, the strong recommendation that's been national and international at this point for any system that's working with adolescents who come into contact with the law, and that is to adopt a valid risk assessment tool to help with your decision making. So I'm going to talk a little bit about the science behind that, and then talk about what we know to be good practice. And I just want to mention one spoiler alert right from the beginning, that is adopting a tool like the YLS, and the YLS is a state-of-the-art risk assessment tool. It's one of the best out there. Your state has definitely picked the cream of the crop. But simply adopting a tool and training staff how to fill that out, we know does not lead to any change in the way that people make decisions about their youth. In fact, it's the most widely replicated human services research finding is that training staff on any new initiative, new approach, new policy, and then handing them a manual and letting them at it is the worst way to lead to actual change in practice. It just generally doesn't lead to any change in practice. What does is having good policies in place, having good leadership in place, making sure you've got quality assurance, and a lot of the supports around to build a sustainable practice. That includes, in this case, and that's going to be a very important part of my segment here, is the need to guide everybody as to how to use the YLS to make decisions. What does it mean? How does that guide your decisions? And so on. And that's one of the really important reasons for having this webinar with you all, is to provide you with some of that knowledge. So do I have control over the slides? I am going to advance the slide now, but it is not working. So John, maybe you are advancing the slide?
You should have controls, Gina.
Okay, there we go. All right, thank you. So there's just 3 points of research that I'm going to emphasize here about what works with adolescents. So there has been decades of research that have told us at this point that punitive sanctions alone do not have a significant effect on reoffending. That in fact is true with both adolescents and with adults, frankly, that simply doing the time for the crime or punishing the action, so to speak, we know does not have a significant impact on reoffending. If it did, the U.S. would have some of the lowest recidivism rates of any other country, and in fact, we have one of the highest. So research has told us, research with young people that started way prior to them actually getting into trouble with the law has tracked kids over time, and that's where some of this evidence comes from. And the research uncovered the fact that, many kids engage in some kind of delinquent behavior, especially during a particular period of their life. Some end up getting caught, and some end up getting exposed to juvenile justice system or getting exposed to a system in general, so system involvement. Those kids who have gotten caught and ended up in a system, all else being equal, when you compare them to other adolescents that used to do the same sort of behaviors, you find the ones that get involved in the system are twice as likely to end up in the adult system later and committing an adult offense. The more exposure one gets to the juvenile justice system, the more true that becomes. And so it increases exponentially the deeper that they penetrate into the system. Now, those findings came about before people were engaging in all these reform efforts and all of this individualized case management and risk assessment approaches that many states and countries are doing now. This is one of the findings that have led to the reason for doing these, for engaging in these kinds of approaches. And we would expect more recent research is showing us that system involvement isn't necessarily always increasing people's likelihood of engaging in the system when they're an adult, because the juvenile system is doing a better job. Second point is that the severity of a youth offense is not a strong indicator of that person's future pattern of offending. Now, this is a really, really important point. It has been replicated over multiple studies that the offense a youth actually was convicted of or disposed for is not a good indicator of what that youth is likely to do. It's not a strong predictor of future offending or the length of that youth's future offending. It doesn't actually tell us a whole lot, yet that's the way that our system works, and any justice system works, is that the sentence should be comparable to the offense committed. That is the way the system works. We're never going to get away from that being the way the system works. However, to the extent that you can have some discretion and incorporate risk assessment into your decision, it's going to be more effective, because we know risk assessment greatly increases our ability to know what a youth is likely to do in the future in an accurate manner. There's a lot of static and dynamic risk factors that have been tested and identified in multiple studies across multiple countries that tell us what is associated with what a youth is likely to do in the future. Those are the types of factors that you will find in a risk tool like the YLS. And so the hope here is that information gleaned from the YLS is going to contribute to that decision about what to do with that youth longer term, rather than the offense alone. Third, most low-risk youth, by definition, are unlikely to reoffend, even if there is no intervention, and I'm using the term intervention very broadly. That means Judge Walker may impose some kind of probation sentence, or Mr. Minoz might put them into a correctional facility. Those are both interventions. Another intervention would simply be giving a youth mental health counseling and sending them home. Any type of intervention, whether it's treatment, facility, supervision. Low-risk youth aren't likely to benefit a ton from it. As far as we can tell, it doesn't have any appreciable impact on their reoffending. However, if we do mix them with higher risk kids, we do have a chance of making that youth worse. And There are studies that have shown different things. Studies have shown that we are making low-risk kids worse by exposing them to the system because we're exposing them to more deviant peers. There are also studies that haven't shown we're making them worse, but they just show that there's no benefit. So we're not always making them worse. I do want to make that point that not every study shows that we're making kids worse, but they are showing across the board that we're not getting any bang for our buck when we're intervening with these youth in any kind of appreciable way. And so maybe they're better off sometimes having as little intervention as possible. Now, as I mentioned that, and I think it's important that I tell you what I mean by risk when I say that. So risk is a concept, it's a construct that many different fields have. Many fields have their own construct of risk. We're all trying to prevent, we're all trying to manage risk, I should say, minimize risk. In this business, we're talking about risk of reoffending seriously. That's the type of risk we're talking about here. That is all that a tool like the YLS is designed to measure. There are other risks that you all may be concerned about because you are dealing with youth and youth are in your care, and so you might be worried about suicide risk, for example, or the risk that that youth is going to harm themselves in some other way. That's not what a tool like the YLS is designed to do. So we're all talking very specifically about risk of seriously reoffending or risk of being violent. And when I'm talking about low-risk youth, that means they have very few risk factors. There's a very low likelihood relative to their peers that they're going to engage in any more bad behavior, even if we do nothing with them. High risk means, and this is really important, a really important point that we always try to express, especially with the courts. High risk does not mean this youth is going to go out and hurt somebody in the next week. High risk simply means that if we don't do anything to intervene, this youth is likely to go out and hurt somebody or likely to continue engaging in serious crime. If we don't intervene, that's all it means. That does not mean that we have to intervene with these youth by putting them in a correctional facility in order to prevent them from offending. It doesn't mean that we have to intervene with them by giving them 5 different services to attend at a time, which no one is ever going to be able to do, especially at adolescent. They don't need that level of intensity. They do need more intensive services, but we don't want to overload it and set them up to fail either. High risk simply means if we don't do anything, this youth is likely to go out and continue offending. So one of the worst things that could happen is for everyone to use a label that they get from the YLS and think that high risk means this youth now needs to be put in DCFS or committed to DCFS. That's not necessarily the case, but those are the cases that we're looking at for that most carefully, obviously. One other point about this is that if we don't educate all of the system players around what risk means and the issues about needing to try to sort these kids so that they're not together to the best of our ability, then what you find is we do a lot of mixing of low risk and high risk youth. And part of the reason for that is because we like working with low risk kids. Low-risk kids are better to work with. They're fun. They are receptive. They are looking like they're benefiting from our help. They might be more grateful. And so consequently, probation officers may end up spending more time with them. But actually, that could be doing more harm than good. And so we want to really educate everyone who's working with us around that topic and have some good policies in place about what can you do with low-risk youth in order to help them without hurting them. So you're giving them something, but you're not giving them too much. Another point is that adolescent development research that's been around for a long time, and this research has been done with boys and girls in the community starting at age 3. So these aren't kids who are necessarily juvenile justice involved. Hopefully not. When they were 3, they weren't juvenile justice involved. This research tells us that delinquent behavior and some police contact are near normative at some point in most kids' adolescence, and which means that it gets to the point where it's nearly 50% or more of kids will engage in some kind of serious delinquent activity. That's what that means. This research, this epidemiological studies from the US, and they were many years ago, tell us that about 80% of males will have had police contact at one point in their life as an adolescent. That could simply mean that they were pulled over and the police officer told them that they needed to go straight home or they needed to park their car. Could be something minor like that, all the way up to a juvenile arrest. And over 50% of adolescent males had had a juvenile arrest. What this means is it's not hugely uncommon. It doesn't need to be severely punished. Some of this is normal adolescent behavior. We want to hold them accountable, but we want that level of accountability to be comparable to what this youth actually needs, to the extent that we can do that. The other good news is that risk changes over time. So this is a graph. These curves have been replicated in multiple studies of adolescent development and adolescent behavior. What you see is that blue line is indicative of, or is representative of, the average adolescent. The bubble is the point at which many of them start to engage in some kind of violent behavior. They may not get an arrest for that, but we're talking about something serious, like someone got seriously beat up, okay? And you can see about 80% of kids in that, within that 60% group of kids, 80% of them engage in some violent behavior around age 16, 17. For most of these kids, it decreases in young adulthood. Naturally decreases in young adulthood because they're growing up. Their brains are changing. They're having responsibility in their life. Things are changing. And so the vast majority of adolescents who engage in some kind of offending behavior grow out of it. Doesn't mean we don't need to keep the public safe while these youth are in it. Some of them are going to need to be placed in a facility in order to keep the public safe. Many are not. But the idea is that this type of youth is very different than the type of youth who starts offending at a really young age, continues doing that, engages in all kinds of different disturbing behaviors. So that may be they've got an early conduct disorder diagnosis, they've got ADHD, they're harming people in their home, they're harming people at school, they're impulsive, and they've got a lot of behaviors in many different settings starting from a young age. And this group of individuals tends to be the ones that are more likely to continue doing that well into adulthood. This is only about 6 to 8% of males. Very small percentage. Those are the ones that need the majority of resources, are the ones that end up taking a lot of our time. And the idea of a risk assessment tool is it helps give us some guidance about who needs more of our time, who do we need to really worry about, and who needs significantly less of our time, because what they're doing is adolescent behavior. We need to hold them accountable and have some intervention, but not a ton of intervention. What differentiates youth on these two trajectories? Well, research tells us that there's specific dynamic need areas, we call them, or dynamic risk factors that seem to differentiate these kids. And these are the risk factor areas that are measured in your YLS. They're going to be measured in most risk assessment kinds of tools. Any good risk assessment tool for adolescents, that is. These are probably not shocking to you. They're family or poor parental monitoring, having pro-criminal attitudes, orientation, behavioral problems or personality traits that are indicative of someone who may be likely to be antisocial in the future, deviant or negative peers, substance abuse, education and employment problems, so they're not attending school or they're not at all committed to school, they have no desire to be employed, or they just can't get it, and lack of pro-social recreational activities. These are the areas that can change over time. They become our targets for treatment, and every youth can look slightly different. And what the YLS does is it tells us which of these are the priorities for this youth that's in front of us. And that should help drive the case plan. Hopefully that is the information that is given to the judge for dispositional planning to make good decisions about what services, smart decisions about what services youth actually need. And so we're not giving them stuff that they don't. Research actually tells us that the more services youth get, sometimes increases recidivism. It doesn't lead to a lower likelihood of reoffending. Loading people up with services is not helpful. Loading people up with services simply to take up their time is also not helpful. Any study that's looked at this has indicated that it has actually the opposite effect. What we're striving here for is smart case planning, smart dispositional planning, and so we're giving them just what they need. Where a risk assessment tool like this is especially helpful is in this area around pro-criminal attitudes, orientation, and personality, because that may not be assessed by everybody in the same way. This shows the impact that we can have through good case planning for youth in the community. So this is a sample of youth who are on probation. There have been multiple studies of this phenomena at this point. I'm just showing you findings from one study, one probation sample where they used the YLS. And you can see the YLS need areas at the bottom of this slide. What this shows is it compares kids who had a particular need area. It compares the ones who received a service that addressed that particular need area to the youth who did not receive a service that addressed that need area. All else being equal, meaning both kids had the need, one got a service, one didn't. And what this shows you is the difference in their recidivism rates. So this is a sample, by the way, of over 100 kids. So this is group data. What you see here, and this is the most striking, is personality behavior. All right, if youth have a personality behavior problem, that means they're impulsive, they're aggressive, they are probably attention deficit issues, and lacking remorse. So those are the things that we see in that area. If they have that and they don't get a service to address it, 80% of them are like reoffended in this sample. It is the most important need area for us to pay attention to. It is the one need area that we see listed the least frequently in case plans. It is addressed the least frequently, partially because people aren't paying attention to it or people don't know what services they have in their community to address it. As you can see, the kids who had this problem and got a service, their recidivism rate was half that of the ones who didn't. And you can see across the board in almost every need area, simply giving youth a service to address their need significantly decreased recidivism rates or the likelihood of recidivism. This is really important, and training probation officers to do this match well, or parole officers to do this match well, is incredibly important. Making sure that that information is given to the judge so the judge can use it in their dispositional planning their disposition is also incredibly important. You can see how far this goes. And this is irrespective of youth's risk level, so it works regardless of whether youth are high risk. What this is called is risk need responsivity. There are 3 principles. And as I mentioned before, simply teaching probation officers, parole officers, people in facilities, how to fill out a YLS, that doesn't lead to any change. There's been multiple studies showing that that doesn't lead to any change. It needs to be paired with a evidence-based case management system. The risk need responsivity approach is the most widely tested. There's been hundreds of studies on this. Meta-analyses have shown that it works. I'm not showing you the slide of the meta-analyses, but the meta-analyses show that programming and agencies that are hitting all 3 of these principles in the way that they manage youth cases can decrease their recidivism rates up to 50%. It is the most powerful case management approach out there right now. It sounds very simple. There are 3 very simple principles. It is really challenging to implement well, and it takes time. It takes time to implement well, and it takes making sure that everybody's on the same page about how this should work. It is part of the principles that Judge Walker mentioned earlier too. So the first principle is the risk principle. That simply means we want to match the intensity of the intervention with one's level of risk for reoffending. So if we have a high-risk youth, we want to give them a lot of stuff. If we have a low-risk youth, we want to give them as little as possible. The good news is that if you're assessing all of your youth predisposition, which is what AB472 says to do, if all the youth are assessed predisposition, I am guessing, unless Nevada is dramatically different from many other states in the U.S., would be the case, that your percentage of high-risk kids are going to be around 10 to 18%. Studies show us that if you're using a valid risk assessment tool and your probation officers are well trained, your percentage of high-risk youth across the state is likely to only be around 10 to 18%. Okay, so this is the minority of kids that need the most stuff or may need facility.
Gina?
Placement. Yes.
John, sorry to interrupt, but since we're talking about probation officers and youth that we deal with at this point in time, we do have a question regarding openness. So one of our participants would like to know that in court sometimes they find that youth do not wish to talk openly about their issues, and they want to know, do the probation officers or parole officers have tools or tactics that they can use to obtain full disclosure or openness so that the accuracy of the YLS is increased? And this is partly similar to one of the other questions that we had on one of the other webinars. Is there something that you or Kelly can talk about to explain that?
That is yes, that's a great question. So of course, I'm not surprised that they don't want to talk openly in court. There's two or three approaches that can be used to try and increase disclosure. One is making sure that their information is protected, so that if they're disclosing something that's not at all related to the offense that they were just caught for or something, they're not necessarily going to get in trouble for it. So for example, if you are assessing youth pre-adjudication, sometimes even predisposition, and you're going to ask them about their substance use, and youth can get in trouble for using substances, as can many adults, depending on the substance being used, of course, and they may not want to say what they're doing. So if they have confidence that that information is being protected, they're more likely to disclose. Now, not every state can ensure that that information is going to be protected. So at the very least, it should be very clear to the youth what the bounds of confidentiality or lack thereof are. A second approach people use is motivational interviewing skills and rapport building to try and get more information out of youth and families, and being really clear that the idea here is not to bust them or get them in trouble or try and lock them up, but that the idea here is to try to figure out what is going to be the best plan for this youth and their family in order to help that youth be more successful later. Lastly, and this is a very important point, and I think is a really important point that's relevant to the checks and balances that can be performed by the court and the attorneys, frankly. No risk assessment should ever be conducted based on the used self-report alone. When we are doing risk assessment, we follow the principles of forensic assessment. My background is in forensic psychology. We follow the principles of forensic assessment, and those principles are that the person in front of you has every reason not to tell you everything that you want to know or not to tell you the truth. And so you never do a risk assessment based on just what that person says. You've got to get as much collateral information as possible. So the YLS is not simply an interview that's done with the youth. It's also you're gathering information from family, you're gathering whatever information you can from files. And we've also been talking with your probation offices and DCFS in the policies that they're putting together about how to manage new information that may come to light after an initial YLS has already been done, to make sure that that new information is still getting incorporated into the original YLS and the case plan. So that was a long-winded answer, but it's not a simple answer. There's a lot of strategies people use. It's a really important question. So first principle, risk principle, we do more with high risk, less with low risk. The second principle is the need principle. We want to target their dynamic or changeable risk factors and only those factors. That goes back to that graph I just showed you. Really important that probation is sharing with the court predisposition. What are the priority need areas that this youth has? What are the main priority need areas that we really need to try and get into their case plan? That is probably the most important part of adopting a YLS. And lastly is the responsivity principle. This one is more complicated. It's harder to study. This is where really the art of case planning comes in. And it simply tells us that we need to match the mode and strategies of our services with the individual in front of us. So services have special characteristics, the individual has special characteristics, and we want to make sure that those align. So for example, we want them to align in a way that's going to increase the likelihood the youth is going to be responsive to treatment. So some examples are intelligence or learning disabilities. If a youth has a learning disability, we probably don't want to put them in a cognitive behavioral therapy program. If a youth doesn't speak English, we don't want to put them in a group therapy session with all English-speaking people. Some of these are very simple, obvious, common sense. Others are a little more nuanced, like mental health issues. Mental health is not a risk factor. It's not seen as a risk factor in our world right now because research tells us that youth with mental health issues are not at a higher likelihood of offending. It's not a, some are and some aren't. It's not a across the board predictor. For some youth, mental health issues are not at all related to their crime. But mental health can become a responsivity factor when the mental health issues are so serious that we cannot help this youth with other interventions until we address their mental health. So some youth may need medication before we're able to put them in a cognitive behavioral therapy program, for example. So that's where that comes in. Judge Walker was talking about the right program for the right youth, the right decisions and the right programming for the right youth at the right time. That's what this is all about. And the YLS is a good piece of information to help you guys get there. So those are the principles and the approach that folks will be adopting. I'm having slide issues again. Okay, this is the way that approach may look in practice. The earlier that you can implement the risk assessment, so the earlier in the decision-making process that the risk assessment can be done, the more decisions it can be used for. So in places like Humboldt County, which I'll let Pauline talk about later, they do it early on, and it can help divert more youth because it may help the diversion decision. If it's not done until post-adjudication predisposition, then it can still guide the disposition decision. And it should absolutely, no matter at what point in the process the YLS is completed, it should always be guiding the case planning. Okay. So the earlier the better. AB472 requires it be done predisposition, but some probation offices may want it to be implemented pre-adjudication in order to make sure that they're maximizing the benefit. Why do we use standard tools, you guys may ask? Because on a daily basis, you're all making decisions about risk management. You're asking, how much do I need to be concerned about this particular youth? Do I need to worry that this person is going to go out and harm someone, go out and continue offending? How much controls do we need to put around this person? How much supervision? And so we're making these judgments all the time. Why would you need a tool to help guide you to do that? Well, the reason is that some of us might be very good at those judgments, and some of us might be really awful at those judgments. And what a tool helps us do, especially if it's standardized and validated, something like the YLS, is it brings us all to a certain level of competence, which is a good high level of competence, and our judgments about who's likely to go on and continue doing serious reoffending. And make sure that we're all paying attention to the same things. If we don't have a tool, a validated tool that's been guided by research on adolescence, we may not all be attending to the same things. So Judge Walker might think if a particular youth is in a bad mood someday in his courtroom, that youth is a high risk because he's got a really bad attitude. Whereas I might think that youth is low risk because he's doing very well in school, and that might be all that I'm paying attention to, and he's not getting in trouble at home. So we might be attending to very different things in our judgments. And what the tool allows us to do is make sure we're all paying attention to the same risk factors, and those risk factors are defined in the same way. This also increases fundamental fairness. So we're making decisions based on the same kind of process. And when we combine these tools these are known as actuarial tools, so that means they're score-based. That means a score that we are generating is driving a decision. When we combine these tools with a bit of professional judgment, because we also know professional judgment is important, we enhance the decision-making process. So structured tools provide consistency. These are evidence-based, objective, so it's there to help minimize our biases. We all have some bias in some way or another, and whether we're aware of it or not, the likelihood is everyone has some bias in some way or another. For example, when I hear somebody with a Southern accent, I may think that that person has a lower IQ, which I am only raising because research says, except for Kelly, who has a Southern accent, and he is very smart. So research tells us, actually, that most people, when they answer the phone, there is a significant difference that people, when they answer the phone, if they hear a Southern accent on the other end of it, they make this presumption that person is not of super, super high intelligence. I'm sorry, Kelly. But when they hear somebody with like a Yankee sort of Northeastern accent, they make some presumption that person is smart, which is not necessarily the case either. So these are judgments and biases people have they may not even be aware of, and there's been many studies showing this. And so a bias is not always about gender, it's not always about race. There's other things that can trickle in. We may like people more who went to the same graduate school that we did, or the same college we did, or who came from the same town we did, and we may dislike people from a different town, whatever. It's just increasing our objectivity and the fairness in our decision making. All right. So the youth level of service case management inventory, like I said, you guys are getting a cream of the crop. I'm only going to give you a couple more slides, and then I'm going to let John take over. It has 42 risk factor items. They're defined how they should be rated. There's 8 domains that are measured. One domain has to do with the used juvenile history, the official juvenile record. That one can't change other than to go up. That is part of the tool. It's the static part of the tool. The rest of it's all dynamic, and I went through what those need areas are with you. There's a third section, which are the responsivity factors, so other considerations that we might want to include in our case plan. And there's the option to also override. Professional overrides are an important part of the YLS. It means specifically that the probation officer or parole officer, when they fill this out, decided that the score doesn't accurately capture the used actual risk level, and so they're overriding it because there's something that leads them to believe, and it needs to be really spelled out and justified, but there's something that leads them to believe this youth is actually lower risk than the YLS is saying, or the youth is higher risk than the YLS is saying. A prime example is a youth may come up as moderate or low risk on the YLS, but they may be having their first psychotic break, or there's maybe something that just happened to them recently and they are expressing homicidal ideation. They're saying they're going to go bomb a school. They're saying they're going to go kill this guy who just messed with their girlfriend or their mother or whatever. We're not going to decide that person's just low risk and just let them go. We're going to intervene because we're being responsible, and we may need to bump that person's risk level up for a short period of time. Overrides should be kept to a minimum, around 6 to 8%, they say, but it's an important part of the process. The YLS has been tested in well over 30 studies, published peer-reviewed studies by independent parties. It predicts institutional misbehavior and violence. It predicts reoffending in the community. It predicts violent reoffending just as well as it predicts nonviolent reoffending. It works for African American youth, it works for girls, and it works for boys. It has special norms and different cutoffs for kids in facilities as in the community. It is a great tool to be using across your system. Tested by multiple parties. Because it's been so widely tested and it's already been normed, it is not incumbent on your state to locally validate it. It is incumbent on the state to make sure that there's quality assurance and making sure that it's being done properly and being used in decisions properly. And this is the last thing I'll leave you with. I love the YLS. Kelly and I love the YLS. It's a very good research-informed tool, but it's not going to do everything. No assessment tool does, and so it's just important to be mindful of what it doesn't do. It is not a mental health assessment. It is not looking at mental health needs whatsoever. You need separate tools to do that and clinicians to do that. It does not replace judges or court discretion. Obviously, there's other stuff that comes into your decision making that's not necessarily about risk to public safety. It's about other factors. And so it does not replace discretion. The hope is that it will help guide your judgment. And the data Judge Walker was showing us before from CSG was showing that a lot of kids were diverted multiple times. Lots of decisions had been made multiple times, but then at some point they may have ended up deeper into the system. Perhaps if those kids had gotten something, some of those kids had gotten something more intensive earlier on, they wouldn't have ended up where they were later. So the idea is, let's just bump this decision-making process up. Rather than diverting all of them who's a low-risk offense, for example, some of them may actually need some kind of service to help prevent damage later on. It does not tell you exactly what the disposition should be. It doesn't tell you exactly which services should be used. We use training of your staff, policies, and good procedures and good supervision to do that. The YLS is not going to spit out a sheet for you that says, here you go, here's the answer. It's all about training, quality assurance, and supervision, and good policies. Lastly, this does not assess risk for sexual reoffending. You can use the YLS with youth who have been charged with sex offending, and it will tell you about their general reoffending risk. It's not going to tell you if they're likely to commit another sex offense. There's other assessment tools that are designed for that purpose. Sex offenders' risk factors can be a little bit different. The risk factors for sexual reoffending are a little different than what we're looking for in kind of your garden variety delinquent sort of behavior. Okay, and I think that's, oh, lastly, this is the manual from NISAP. It was funded by the MacArthur Foundation. It outlines all the steps to implementation. The state, and by the state I mean DCFS and probation, are working with us. We're all working together to help implement this tool well. Pilot sites are being used. The idea is to have it pilot tested, which is just good practice whenever you're implementing some new big innovation like this, so people can work out the bugs before the entire state gets it. And this manual is available online if anybody's interested in any parts of it. And so then I will leave it at that and turn it back over to John.
Thank you, Dr. Vincent. We'll go ahead and a minute for questions. I know we have one on the chat. If a YLS is conducted in a youth reoffense, how often should an updated YLS be conducted? Is there a best practice in this regard? For example, every 6 months, every 12 months? Gina, would you like to?
Yes, great question. So in general, the practices usually recommend that a reassessment occur at least every 6 months. Now that can be kind of a long time for youth. High-risk youth, some agencies have special policies just if the youth is high risk that they want to reassess every 90 days. If a youth is in a facility and the goal is to not have them be in the facility for years and years, like what DCFS's goal is, then generally want to reassess every 90 days. On probation, it's common that it's every 6 months, but it can be at shorter intervals. And certainly you want to reassess when there's any major life change that may have an impact on the youth's risk level, like they committed a new offense. And I think that the plan is, and I think this is an AB472, so John or Judge Walker can correct me if I'm wrong, but you should be reassessed if they commit a new offense so that that information is recent and fresh and is there when any disposition recommendation is made based on that new offense, whether that youth is on probation or parole, right?
That's correct.
So that is best practice. Okay, that is best practice.
It's going to be at a minimum of every 6 months, but we will be reassessing them anytime, like you said, that there's a new violation or that we're looking at before we do disposition on, if we're looking at revocation or commitment, and or, like you said, a life-changing event,
yep.
Which is a number of different things, but that's the overarching answer to it.
Yep.
Can I add something?
Of course.
I do think that that it's important for us because when we're working with our kids, we're constantly getting information anyways. which allows us to do different types of reassessment. It's not a formal YLS reassessment, but we're constantly gathering information. And when we tie that into our case plan, it also allows us to identify and celebrate with the youth and their families when they accomplish a goal, or when they have a domain where their risk and need when it drops and decreases. So I think with probation and parole, we're constantly reassessing anyways, because we're working with them. So in order to do, it's not that we have to do full assessments. In Humboldt County, we do a reassessment if we're looking at a higher level of care, so that we make sure that we're moving in the right direction. If there's a new offense that is a serious offense, we don't reassess for technical violations or anything like that. It has to be a delinquent act. And if we're looking at moving the youth off of probation and successfully terminating them, even if that's within the 6-month period, we will do a reassessment also.
Very good. Thank you very much. Okay, so if there's no other questions, are there? Okay. Now I'm going to lead us into the next section and then hand it over to Judge Walker. So we're going to talk about implementing the tool in the legal setting, but before we do that, I want to talk about the JGOC and the 5-year strategic plan. So per AB472, the purpose of the 5-year strategic plan was to establish policies and procedures for the Division of Child and Family Services and each department of juvenile services relating to the use of evidence-based practices and providing services to children subject to the jurisdiction of the juvenile court. So let's take a look at some of those goals and performances here. So I'd like to highlight the strategic goals of the plan, which are here. And they are to have the counties, the state, and facilities and service providers use evidence-based practices and programs, to have risk and needs assessments and mental health screenings inform courts' decisions, to have collaboration across systems to meet youth needs, and to have family engagement plans and case plans in place for every child in the juvenile justice system. There are also a number of data and performance measures we must collect, but we'll talk about that more later on in the presentation, and that's the D's down here. Okay. AB472 also established an evidence-based program resource center, now referred to as the Nevada Center for Juvenile Justice Innovation, to support quality programs and practices in Nevada's juvenile justice system. DCFS selected the National Center for Juvenile Justice, which is the research division of the National Council of Juvenile and Family Court Judges, to design and implement the Resource Center in collaboration with DCFS and other stakeholders in Nevada. The mission of the Nevada Center for Juvenile Justice Innovation is to provide research, training, and technical assistance on evidence-based programs, practices, and tools to be used by the counties, the state, facilities, and service providers. Please take an opportunity to visit the site through the DCFS website and check out our newsletters and links to additional resources. A lot of you should be getting email blasts that we send out. And I think one just went out recently, so please take an opportunity to open that up and take a look at it. So AB472 also requires Nevada to utilize a statewide risk and needs assessment and mental health screening instrument, convert to a statewide case management system, and to implement evidence-based practices and programs. The tools Nevada has selected thus far are listed on the slide and are in various stages of development and implementation. Once we all start using the same tools, we will be better able to use a common language when talking about youth needs, have consistency in case planning, and track outcomes reliably across the state. Unfortunately, all things come with a cost, and these are no exception. While the state has covered some initial implementation costs during this current biennium, it is expected that counties will need to incur ongoing costs moving forward. Some counties, however, are already covering their own costs and have been using these tools and programs in their own jurisdictions, such as Humboldt and Carson, and in some cases, Clark County. So we're going to talk about ensuring effective implementation, and Judge Walker, would you please take us through this next section?
Sure, thank you, John. So the theme of this next section might be not so jokingly, but maybe humorously entitled, why shouldn't I send these kids away when they piss me off? And the key to effective implementation really is that the system, meaning courts, prosecutors, and defense attorneys, be armed with information on a risk-need responsivity scale, if you will, from the statewide uniform tools that would be actually executed by the justice agencies. So courts are required to use that information and analysis to make determinations, and those determinations must be substantiated by findings that the courts will have to make at different decision points in the life of any particular case. Next slide, please. Specifically, for example, NRS 62E506 requires that upon the selection and adoption of the statewide uniform risk and needs tools, which again are the YLS and the MAISY-2, Department of Juvenile Services in each jurisdiction is required now to prepare a report on the result of those assessments. That report must include the child's risk to reoffend, and again, the emphasis isn't on their risk to do something dangerous in the community. The emphasis is on whether or not they're at risk without services to reoffend in some way. A supervision recommendation, and then the service needs of the child. It must be that report must be provided to all parties, and the court's required to use that report to assist in its disposition determination. Next slide. To effectively implement, we have to share that information, and that information specifically has got to go to the court. So it must be conducted prior to disposition and after adjudication at least, so that each probation department shall generate a practice for accomplishing that's feasible and protects the rights of youth and families. So we're going to have robust discussions across the state, for example, about whether or not the tools should be used prior to adjudication. And I think Pauline will have some commentary about the experiences that they're having in Humboldt County in that regard. Information, at least predisposition, that must be shared in the reports is, again, the level of risk for reoffending, according to the YLS and the CMI, the dynamic risk factor domains or the needs area for that child, prioritized by their scores on the instrument, and other relevant factors, again, with narrative description in the reporting, and then the proposed plan for addressing those factors. And I don't know, Dr. Vincent, if you wanted to weigh in at all on the effective implementation at this point.
Thank you, Judge Walker. Just that was great. Not much to add. Just a quick note to say that we think the important point here is that at the minimum, the court should be expecting to get this information, and the goal is to train probation officers who are making the disposition recommendation to share with you what they think the priority need areas are, not necessarily the scores on the tool, because the scores aren't actually helpful. Knowing something is low, moderate, or high risk. Knowing youth is low, moderate, or high is what's helpful. Whether they're a 30 versus a 32, not helpful. The scores within each of the dynamic risk areas, not helpful. What's helpful is knowing what are the priority need areas that have been selected for this youth. You may have youth that have 5 need areas at a time. We can't always address those all at a time and expect that to work. So always want to see in the dispositional recommendations what are the priority need areas and what is the suggestion for how to address those. So that's the main point of this slide. There's individual items on the YLS. There's 42 individual items. There's strengths, so knowing what the strengths are of the youth is also very important. Strengths are an important part of case planning. Knowing necessarily the individual risk factors is also not helpful. The tool is validated in a way that the risk level is what matters and the domain areas are what matters. The individual items don't matter as much. Having some narrative description of what's going on within each of those need areas, that's really important. But one of the goals of this webinar also is to hear from you all if there's other information that you feel like you really need to help make those decisions that may come from the YLS. Thanks, Judge Walker.
Thank you, Dr. Vincent. John, could you move to the next slide? So to any of my judicial colleagues listening, I would just emphasize the following point. The purpose of these tools isn't to give us a decision matrix, to say that the kid scores XYZ number of points and therefore the mandatory outcome for disposition is whatever the tool says. The risk assessments are intended to be but one piece of information to consider in processing decisions. There are, of course, other relevant factors such as accountability and the severity of the offense. For example, a kid who commits an attempted homicide who is, for whatever reason, still within the juvenile system and not by his actions or by certification outside the jurisdiction of the juvenile court may be a low-risk kid to reoffend, but require a response for accountability or public safety concerns that is different than the tools might seem to indicate. But actually, I think the obverse is the more important point. So I can't think of how many times I've had a youth parolee or a probation kid go out and commit a series of autoburgs in a community. And I have a courtroom full of ticked off citizens because their cars have been broken into, their property's been stolen, and a probationer or a parolee is adjudicated delinquent for those actions or acts. Well, that kid may make us all mad, and there may be a hue and a cry for accountability for that kid, but we need to make sure that the decision we make about the treatment and the resources that we apply to that kid is driven by data and not by emotion. The risk assessments, as a consequence, don't mandate any proceedings or dispositions, and the recommendation can be unreliable in a small number of cases, and that's the purpose for overrides. And Dr. Vincent, can you give us some examples of the cases where you think the recommendation can be unreliable?
Yeah, sure. Thank you again, Judge Walker. So this goes back to a point I made earlier that research tells us over decades that developing these actuarial tools greatly improve the accuracy of our accuracy and our ability to predict what people are going to do in the future when it comes to violence or reoffending. They greatly improved our accuracy, but no tool is going to be accurate for every single case all the time. And that is why all of these tools have this override option, which is not an override of the decision, it's an override of the risk level. So the YLS says the youth is low risk, but the probation officer knows there's these idiosyncratic factors to be considered that bump the youth's actual risk level up. So the instance I mentioned before, you may have a youth who's low risk, but they're currently homicidal, or they're threatening that they're going to bomb a school, and there's some seriousness to that threat. None of us are likely to say, well, that youth is low risk, we don't need to be worried about this at all. Like, we're going to want to do something about that probably. And so there's an instance where that's not something that's predictable or measurable. You don't see that as a risk factor in any tool. You don't see bomb threat to a school as a risk factor in any tool. It's something that just happened in this particular case. We need to attend to it, and it may be worth overriding. Another example in the other direction is you've got a youth who has been a bully their whole life. They've hurt a lot of people. They have no reason, no remorse, no empathy, no reason not to keep hurting people. But recently, in this particular offense, they were in a very bad accident, broke their back, in a wheelchair. They're not going to be moving around anytime soon. That's another idiosyncratic factor that has just influenced that youth's risk level. And so, in that case, we might be bumping it down. These are situations that really happen. They're those random sort of events. Well, no, they're not entirely random, but they're these events that are not at a common occurrence that are going to affect our final decision of a youth risk level. And so we need to allow those to happen. They should happen responsibly, with very good documentation and justification, and in a very small percentage of cases.
Thank you, Dr. Vincent. Don, would you move to the next slide, please? So again, to my judicial colleagues, I'd emphasize it, not just to my judicial colleagues, but to all of us who are going to be stakeholders in this process. There are now specific findings that the court must make in order to commit a child to DCFS. And the first of those findings is that appropriate alternatives that could satisfactorily meet the needs of the child do not exist in the community or were previously used and proved unsuccessful. And again, the emphasis is that those are the dynamic risk factors or criminogenic needs identified in the YLS, that those specific needs can't be met in the community or were previously used and proved unsuccessful. And number two, that the child poses a public safety risk based on the child's risk of reoffending according to the statewide tool. And again, that's not a gut check. I think this kid's dangerous finding. That's a finding that based on the scoring on the tool, the child has a significant risk of reoffending. And both of those findings have to be present in the commitment order in order for it to be a valid order. Next slide, please, John. Again, for placement out of state, so not just commitment in state, but for placement out of state, there are two specific findings that the courts will have to make. That there is no public or private institution or agency in Nevada to meet the needs of the child, or that such an institution or agency attempted to meet the child's needs but was unsuccessful, and reasonable efforts have been made to consult with public or private institutions and agencies in Nevada to place or commit the child in Nevada, and those efforts have failed. And I would just emphasize this reasonable efforts finding, to my eye, is almost directly analogous to the reasonable efforts finding that has to be made in child welfare cases. And reasonable efforts means something more than sort of a run down the list cursory check with resources inside the state. It involves some meaningful dialogue with providers to see if there isn't a program that meets the needs of the child before we send a child out of state. Next slide, please. At parole revocation, youth parole is required to adopt policies and procedures to have an objective system for responding to parole violations up to and including revocation of parole. And parole may only recommend revocation if a child poses a risk to public safety and the policies or procedures adopted by parole respond to the parole violation was followed, or that other responses permitted by the policies are not appropriate. So when a court's considering a parole revocation decision, each judge has to take into consideration whether or not youth parole has adhered to their policies, and it will be a best practice for the court to make a specific finding that youth parole has or has not followed its violation response procedures, and whether or not the youth is a risk to public safety. So it takes out, I don't mean to imply that any judge is a rubber stamp, but it takes out the possibility that the judge would say, parole's recommending revocation, kids revoked. Next slide. There are some implementation guides that are, again, on the DCFS website that are available to all of you. Those implementation guides are checklists in order, so they summarize, for example, the disposition decisions that need to be made, the commitment decisions and placement decisions, and then parole revocation decisions that need to be made. There is a bench card, if you will, that is a prompt for questions to ask. At disposition, for example, again, has the agency completed the report? What is the risk to reoffend? What is the level of supervision, et cetera? All the way through commitment, out-of-state placement, and parole revocation. There's a prompt for findings that need to be made at each of those specific decision points. The report indicates that the child's risk to reoffend is X, the supervision recommendation is Y, and the recommended services are Z, for example. And that is at each stage: disposition, commitment to DCFS, placement out of state, and parole revocation. The quality assurance reviews things, I think, John, go back over to you.
Yes, thank you, Judge Walker. I appreciate that. I'm going to take us through the last few slides and then see where we are with our time. So what I want to review first is our quality assurance reviews. This tool will be used to annually review the use of evidence-based cognitive behavioral therapy programs in all of our facilities, and a team of reviewers is being trained to conduct the reviews. So as you can see, per NRS 62B and .620, this requires the JJOC to conduct annual quality assurance reviews for each state juvenile justice facility and each regional facility for the treatment and rehabilitation of youth. The JJOC selected the Correctional Program Checklist, otherwise known as the CPC 2.0, and that's the tool that we're going to be utilizing at all of our facility reviews. The evidence-based CPC tool was developed by the University of Cincinnati Corrections Institute for assessing correctional intervention programs. The CPC is designed to evaluate the extent to which correctional intervention programs adhere to evidence-based practices, including the principles of effective intervention. So I just want to also add in here that some of you had its review back in June of this year. Spring Mountain Youth Camp had theirs in September of this year. China Spring had theirs in October of this year, and NYPC and Cayenne will have their reviews in the spring of 2019. Performance reporting. Recidivism rates will be measured when an individual within 3 years of initial arrest, citation, adjudication, commitment, or placement into an out-of-home facility, placement under probation or parole supervision, or when convicted as an adult is rearrested, re-adjudicated, or recommitted, or in violation of supervision, or convicted by an adult court. One of the biggest indicators that we know is of whether or not we're making a difference has always been recidivism rates. And we will be collecting this data and reviewing it to drive practices and programming. And as I think somebody mentioned earlier, it's been said that if it doesn't work from now on, we're not going to be funding it. So let's talk about, performance measures. Having my own issues here. We will be collecting data on juvenile justice court performance measures, probation and parole, state and correctional facilities, group homes, youth camps, and RTCs. The data that will be collected is listed on this slide. During the next few years, we hope to establish a baseline of where we are and then use it to make specific adjustments to our practices, programs, and decision-making to have better outcomes for youth and families, and ultimately safer communities. The pilot will be used to gather qualitative data on the effectiveness of the policy and procedures and whether there has been a change in dispositions. So as we talked about earlier, when we talked about the goals of the 5-year strategic plan and those performance measures that we have to capture, that's these listed here. And again, I just want to make sure that we all understand that the juvenile court's going to have performance measures, so is probation and parole, our state facilities and providers as well. Okay, so we'd like to use the remaining time we have for representatives from Humboldt County to provide insight and feedback on the implementation of the YLS in their jurisdiction. But before I do that, I just want to open it up again. Are there any questions from any of our participants on the webinar today? If you have any questions, please feel free to unmute yourselves and ask those questions or type them into the chat box. Do we have any questions? Okay, so Pauline, can you please introduce yourself again and the representatives from Humboldt and share your experience with the YLS with us?
Thank you, John. I'm lucky that we have our court master, Gabrielle Carr, who's actually joining us today. I'm going to have her go first just to share the process that we went through to implement the YLS. Master Carr has been with us through this whole process and has really been a pivotal person in us being where we are today with it. So Master Carr, I'm going to have you go first if you're okay with that.
Absolutely. Can you hear me?
Yes.
Everyone
yes.
hear me? Okay, good. Awesome. Well, I don't know if any of you know, but I've been a court master for a year now, so it's only been a year. But in that year, a majority of my cases are the juvenile delinquency matters, and we started using the YLS probably, I'm guessing, maybe in January. So it's been several months, almost a year, that we've been utilizing it in my decision making. I'll just share a couple thoughts about it, how I feel, because I started, you know, I dealt with family law and child-related cases for most of my career, which has been more than 20 years in the practicing law. And this, from the judicial perspective, increased my comfort level as having unbiased, or at least somehow eliminating or reducing the risk that there was explicit or implicit bias in the recommendations coming from the juvenile probation officers. There were some cases initially when I first started where I was like, is this objective or subjective coming from, you know, the recommendations that I was receiving from the probation officers? And so the YLS seemed to be a really incredible tool to help alleviate that, or at least reduce that risk from my perspective. And so we utilized it, and we have been utilizing it. I previously, and I changed my practice very recently, been actually having it marked and admitted as an exhibit. I understand that's not best practice, so we're looking at other ways to bring it in through evidence, either through the dispositional report, being marked and admitted as an exhibit, or having the, I like having the juvenile probation officer sworn in so that their recommendations and their information from the YLS comes in that way. But it allows me to look at the treatment services that are being recommended, and I feel a greater level of comfort knowing that the higher risk areas, or the risk areas for that particular youth, are being specifically targeted through the treatment services that are being recommended. And I haven't talked to Pauline about this, but I would really like to see in the dispositional reports, or even in the recommendations in court, the specific treatment services that are addressing what specific risk area. I don't know that we've broken it down specifically, but it seems like it might be helpful to know these are the treatment services that we believe that can be implemented to address this specific area. And I understand there may be some that go across to different risk areas. So you're going to have treatment services that might address one or more of the risks. But it's helpful for me, I think, to see, or at least hear recommendations and have supporting evidence and assessments that give me that feedback, so that when I make a decision, I feel like it's a more informed decision and it's more fair and objective because I have those tools. So we've been, at least for me, before disposition, I will continue disposition if I have to. Generally, I'd say if not 100%, very close. It's still within the 60 days. But I want a dispositional report. I want the YLS conducted. And I've been asking for the MAISI conducted because even though the statute didn't specifically require it yet, I wanted those things because they helped me from the judicial position to, in my opinion, feel like I was making a more informed or educated decision regarding that particular youth. Because I could guess all day long what I think that would be good for that kid, but to have those tools helps me feel, or at least makes me feel like the decisions I'm making are targeting the specific needs of that particular youth. The other thing too, before you talked, Judge Walker, about 62E525, which is the findings you have to have before commitment. And one of the things that I've been requiring in each of my cases, in addition to the assessment, was an actual psychiatric evaluation, so that I have some diagnoses and some recommendations before going to that level of services, because for me that's a tough step to take. I know that it's necessary for some kids, but the more information and evidence I have to support a finding that says that child, you know, needs that higher level of service, then I like that. I know that might be a little off topic from the YLS, but it did, the question was raised in my mind, or at least wanted to bring that up when Judge Walker was speaking. And I'm looking forward to that bench card. I saw on the screen the little check, or, you know, boxes on that. I really am looking forward to that. That's helpful to know, make sure I make the appropriate findings in court on that. But I really like the YLS assessment, and I appreciate, and I'm happy to answer questions about that, having implemented it, or I'm happy to hear from others too, if they've used it and if they like it. I know that was a lot all at once, so I'll turn it back over to Ms. Sala.
I'm not sure, John, if there's any questions specifically that people have. The good news, MasterCard, is that actually we'll be working with Gina and Kelly the first week in December to work on our service matrix, to tie our services right directly to the priorities for our youth. So I think that you'll really like that, and you can actually, I was gonna invite you to be part of it, so I'll just drop it on you now, because I think that really is one of the areas that we need to move our focus on, because we've done a lot with the implementation of the YLS. And I just want to throw out there that this is a process, and roundtables are not always easy when we're bringing judges and probation and treatment providers and public defenders and district attorneys to the table. It's not always an easy conversation, and I would just encourage everyone to stay the course, keep your eye on the prize. There was several times I was like, whew, I don't know, I might need to take a step back here. But we stayed the course, and honestly, I think that we all know that our stakeholders in our community really just want what's best for our kids and their families. And whether they're probation kids or parole kids, you know, to me in Humboldt County, they're all our kids. It doesn't matter if parole's supervising them. They're our kids. They came from us. Parole wouldn't have them if we didn't commit them. So we make sure that whatever level of supervision is, that our kids and families are getting what they need. And I think if we remind ourselves when we're coming to the table to develop our agency policy and to implement a plan of rollout, just know that it's not always going to be easy, or there's going to be some frustration, but we are walking proof that it can be done. It took us a long time. We rolled it out in April of 2017, and we're just now to the point where we feel really comfortable administering it, providing it in our dispositional reports, and speaking about it. So it just takes commitment and patience. And the other thing is that I really feel like, let me back it up. We have a less than 2% override percentage of our YLS, but we also had to have additional training on that. And that's one of the areas where we want even more training on, because I'm not sure that's really, we feel completely comfortable with that area. But one thing we do feel really comfortable about is that less than 5% of our kids in the last fiscal year escalated to probation status. So the majority of our kids were diversion and informal. We utilize supervision and consent also. I mean, that's one of the levels of supervision we have, but only 5% of kids move to like formal probation. We feel really comfortable with that, because we know that those kids that we went to court on requesting formal probation, that we had the facts, the support, and the areas that we needed to provide help with. Like we knew that that our information was accurate, and this is the level of service that those youth needed. So one thing the YLS has done for us is that it has increased the number of kids we divert and decreased the number of kids that we go to a formal court hearing on. So I think that's really an important piece. And earlier we talked about, like, how do we get the information from the youth and their families to make sure what we're capturing in the YLS is accurate. I think that part of that is just the nature of this beast. And we focus a lot of our time on collateral information gathering. And we do use motivational interviewing skills. We spend a lot of time going to additional trainings. The probation department, my detention staff, we spend a lot of time getting trained on motivational interviewing, because I do think this is somewhat a new concept for juvenile justice, is to do some motivational interviewing instead of saying, like, yeah, you violated, now we're going to lock you up and we'll go to court. So it was not only that we needed additional training, we had to do a culture switch. which actually I think was harder than the training. So that's one of those areas you have to stay the course. The staff needs to know what the big picture looks like and our why of how come we're doing things so different. Because it is reform, and culture change takes a long time. So although our kids, we know that some of the information our kids are self-reporting is probably not all the way accurate. There are other ways that we gather collateral information. I mean, for those kids we have on some level of supervision, we have some monitoring like activities that we can use, right? I mean, we know if we're already drug testing, we have drug testing. If they're already in counseling or we've been working with the school, we have all that information. So I just think that that the motivational interviewing training is really important, just to gather as much information from the families and the youth as possible. And it does mandate that there's a therapeutic alliance, and I say therapeutic even in the juvenile justice field, because we are moving towards more of a therapeutic model here with motivational interviewing, that we start working with our families like a team, and not that we're just providing orders and requests and wanting them to do whatever we tell them. So that is kind of a switch. And then the last thing I'm going to say, unless there's questions, is that one of the other benefits from the YLS for us has been that our kids are not staying on supervision as long, because we have our domains that we focus on. We have their risk level of reoffending, and we really keep our focus more like just clear on what the youth and their families need, because I think we all know what happens when our kids get on some form of supervision with us is we keep finding all these things out, right? Oh my gosh, now they're fighting at home, and oh, now they skip third period, and we start finding all these issues that our kids are having. But if we look at it like, if this youth wasn't on supervision with us, would that really be an issue to anybody else? And for us, it becomes a focus. So with the YLS, it keeps us focused. We know that if their level of risk and need, well, if their need is decreasing, their risk to reoffend is decreasing, we can move these youth off, right? Not that we cut off all their support, but we can move them off the court system, the official probation system. And I think that that's been one of the biggest benefits for us, because we had kids on probation for like 18 months, 20 months, and I'm now, hey, you got 5 months, you're done, we're going to move you. This is not, let's do what we need to do. So I know that some of the concerns are just the additional time and effort the YLS is going to take, but in the end, it just decreases the number of court hearings we have. It decreases the amount of time that we're spending with these families putting out fires, because we're wrapping the right services to the right kid at the right time. And it really does save time and money in the long run. And it allows our families and youth to move on, because although we love them, even the hard ones, we want them to move on. So, I mean, I can go on for hours, but.
Well, Pauline, this is John. I heard you say a lot of things there, and it sounds like you have really taken a look at your data and what's changed, what hasn't changed. It sounds like you've had a lot of, as you put it, cultural changes within your own department, which is phenomenal for an agency to do. And I know you touched on some of the issues that you've had, your own staff and working with the kids. But for this particular webinar, what were your challenges like working with your district attorney's office and getting them to, as you say, see the bigger picture, and with your hearing masters? And when you're done, I'd like to hear from Kelly and hear about what his experiences were in Louisiana and working with that group as well.
Thanks, John. I think we encountered different issues between the public defender and the district attorney, but in reality, they really were the same issues once we like really drilled down on that. And to me, it was just about changing how we do business. But to them, you know, I think my district attorney participated in the first one for the attorneys, and he said, you know, the biggest thing for him was like, what do you mean we're not going to, you know, prosecute these guys? Or what do you mean you're not going to move this to a petition for me? Like, give me that report. I want that petition. And so then it really took some time working with him. And I actually had him do a YLS webinar one time with me. And then I just said, you know, like, hey, this is really going to help you focus on the kids that we need to go to court and not worry about the ones we can divert. Like, let us worry about them. It'll free up some time. It really, I'm really lucky because the district attorney just started really trusting the process, which I know is not always the case, and really watched how we were doing it, what the YLS, you know, looked like, did some more follow-up with that. And then the first couple of months that we were using them in court, we spent a lot of time before going to court, having a conversation with him about why this one we are going to court, we want to go to court, or a petition to be filed. We really had to bring him into the whole process so he just could understand what that looked like, because, you know, really in reality it could fall on his office if we're not doing good juvenile justice here too. So it was a culture switch for him. And with the public defender, we were just getting a new alternate public defender that was handling juvenile justice, which really, I think, made this process even go a little smoother, because she was involved with us from the beginning of the process and trying to understand it. And one of the things that really got her bought in is when I said, like, hey, you know, we're looking at 70% of our kids being diverted. Like, we're going to divert them. You're not going to see them. And that really interests her, because I think there for a while we were taking lots of kids to court that didn't need to go to court. So yeah, I think my recommendation would be to find what's important to whatever side you're working with and provide them information that supports the implementation of the YLS and the MAISY. It's hard to argue with evidence-based and reliable and validated tools. It's hard to argue why we shouldn't use them, is what I kept repeating to them. Like, how can you argue against this? Like, so, but it was really a lot of education and just making sure they felt included in the process. Like, they reviewed our policy. I mean, I'd say, hey, look at this. What do you think? Our consent to participate in the YLS from the youth and the families, I sent out to, you know, I sent it to them too. Like, what do you think? Just so everybody's involved right from the beginning.
Thank you, Paula. Kelly, can you share some of your experiences and recommendations as well?
Sure. Excuse me. I guess what I would say is it's very similar to what Pauline has stated here in Louisiana, cross country. But what she explained, you can multiply that by 64 because we have 64 parishes that we were bringing on board here in Louisiana, several hundred judges. And we went through the same issues. And I guess what I would say is the most important thing for judges, district attorneys, public defenders, probation officers, everyone, is to go in with an open mind. And as she said, trust the process. I think you're going to expect when you implement anything new that there are going to be challenges, and that, you know, everybody feels that they serve an individual role in the process, and they want to protect that, which is okay. So here in Louisiana, assessment tool has been being used for the process began 10 years ago. And I know it's day before holiday, and everybody's probably ready to go. But just one quick thing. Within the last couple of weeks, I had lunch with one of the juvenile court judges out of New Orleans, out of Orleans Parish. And we were talking about the assessment process. And this was a judge who was not necessarily on board. He had been a judge, for years prior. And I think he felt that, he was doing a really good job. And to some degree he was. And he really didn't need this tool. And like Gina said, some people are pretty good determining what kids need, but most of us are not. And he may have thought he was, but he wasn't. And so it was really interesting having lunch with him the other day for him to admit that. And he said something similar to what Judge Walker said regarding that the decision should not be driven by emotion. And he used very similar wording, which I thought was interesting. Because he realized that what he's been doing since has made such a difference in many of the kids' lives. He realized that he did not have to incarcerate so many kids and still have the same outcome when it came to public safety. And that's always one of the major concerns, is public safety. And so I think once he began to trust the process, he realized that his decisions should not be made on his gut feeling, emotion, and also that as a judge, he said it shouldn't be made on outside pressures. And he said the reason he was able to do that and not let that influence his decision was because he had an evidence-based tool that he can refer to. And so that's really helpful, especially on high-profile cases. So I just thought I'd share that because I thought it was really interesting. It was a great lunch, and it was really good to hear him to say so many positive things about the assessment process and how he feels it's changed how he runs his courtroom. And he actually stated that he wished he had had it years earlier, and that he probably would have made much better decisions back then. So, if there's any questions or anything else that y'all like me to add, just let me know. But I just want to share that quick story.
Great, thank you. Okay, so are there any questions about anything that we've talked about? Do any of the participants have any questions? If so, please let us know. If after the presentation is over, if you have any other questions that come up, please feel free to reach out to me. This is my contact information. And before we go, I want to give all the presenters an opportunity, if there's anything else you want to say before we go. I think what we heard today was very important, but I think one of the things that we probably should do is make our mantra from now on, trust the process. I heard a couple of you say that today, and I think that's probably something I'm going to start repeating to my staff when we have these conversations, because it sounds like that's really what this is really all about, is moving away from our gut feelings and because we've been doing this so long, we know kids and all this other stuff. I really think that we just need to trust this process moving forward. So I want to thank everybody for sharing that with me. I wrote it down several times now. I think I'm going to put it over my door. And every time somebody comes in with a new question about why we're doing this, I'm just going to point to the door. So I think that's great. But before we wrap up this webinar, I'll give it back to Judge Walker. Judge Walker, is there anything you want to share with us before we leave?
Just that it's trust the process, not trust Pauline. Trust the process.
I am part of the process. Oh, yeah. Judge Walker, I miss you so terribly.
Pauline, is there anything else you wanted to share?
I just think you're all great.
All right, thank you. Dr. Vincent.
No, thank you. I think that the stories from Pauline and Kelly were terrific, right on point, perfect examples, and we're looking forward to working with all of you and continuing to work with the ones that we have been working with.
Thank you. Mr. Clement.
Oh, no, I'm good, other than have a happy Thanksgiving, everybody. Oh, and I do have to talk to you about this accident.
Yes, we're going to have to talk about that accident, ma'am.
Yeah. Research shows.
All right. Well, I want to thank everybody who participated today. Thank you very much. have a good holiday. Thank you very much. Bye.
Happy holidays.
Thank you, guys. Thank you. Happy Thanksgiving.
Happy Thanksgiving. Bye, everybody.
Bye.